Yep. Hello, good morning, everyone. My name is Joseph Ebirim. I'm a pharmacist. Okay, so today I want to address the issue of careless talks about health workers and hospitals. Okay, so this morning I walked past two guys, and then one of them was talking about student doctors and how they leave certain things in people's bodies after surgery. And then I wondered what he actually meant to achieve, because that's actually a very careless statement. Now, the repercussion is that many people hear these kind of things and it worsens our bad habits already. Nigerians have this habit of poor attitude towards healthcare, especially when they are even ill. They come to the hospital or health facilities and even try to dictate to the professionals what should be done. And sometimes they put up certain attitudes, reject doctor's advice or the advice or counsel of a pharmacist and all that. And at the end of the day, they suffer dearly for it. And the bad side is that many of these people, when they go through the consequences of their actions, they never share it. But it's easy for many people to share, the ordeal, the bad things they have, the sad things they have in mind about, health workers. I'm not saying all health workers are saints, but the truth is that there is more to lose, when you talk bad about health workers. If you have any issue with any health worker, I recommend that you face, that particular health worker or the facility squarely. Exercise your rights. If you need to sue, fine, it's good. But don't go about spreading falsehood, unfounded statements, and even statements that are capable of misleading very vulnerable people. That's the point. Not that you cannot say or share your experience, but make it also abundantly clear that people differ and there are so many good practitioners out there, so that you do not spoil or bias the mind of the next person. And when he or she is in the position to seek healthcare, they renege, they hesitate, and at the end of the day, suffer dearly just because of the bias your statement has created in their mind. Health workers are professionals whose work is actually fueled by passion to save lives. It's not just a jolly good ride or easy one, but it's one that's filled with risk, because every day you encounter a couple of people, be it the doctor, nurse, pharmacist, even the worker at the morgue, or even the cleaner. These people face a whole lot of different kinds of patients. Either they are the stuffs coming out from their bodies, the blood, fluids, the feces and all that. These persons face a whole lot of things they'd never bargained for, in a particular day, because you never tell who is coming to the hospital. So let's encourage them, let's hail them and encourage them in the kind of work they do, because apart from just working to earn for their living, they actually do the work of caring and saving lives. So they deserve your support. Okay, not just because I'm a health worker, but come to think of it, that's the truth, because it's very likely that at one point or the other, you will fall ill and you will need the services of a healthcare worker, not only a doctor, not only a pharmacist, but even sometimes the ambulance driver. He may look just like a mere driver, but in the event of emergency, you see his value. So even the guys working at the morgue are very, very, very important, because the way they take pains, and they go through a whole lot of emotional work and effort to put, the corpses deposited at the morgue in order, so that whenever you need them, you need to come and claim yours, then you come and you're able to make your claims and, go and give the person a final or befitting burial. So let's hail health workers. They do a lot of job, they do a lot of good things. And then let's ensure that we not only desist, but encourage others to desist from making unfounded statements, derogatory statements, bad and misleading statements against health workers.